Preparations for the 21st annual Steve Biko Memorial Lecture are in full swing. Now, this year's lecture will be delivered virtually by the first female director of the World Health Organization, Dr Matshidiso Moeti. And this coming Sunday, of course, will mark the 44th commemoration of Biko's passing in police detention. And the world currently is in the midst of a pandemic, the COVID-19 pandemic, and given that backdrop, Dr Moeti's prolific medical and administrative background to boot, the topic is most likely also going to feature quite strongly, especially from an African perspective, how this has played out, because the global vaccination rollout again showed how the world, and the Western world in particular, views Africa and how the continent has been shortchanged yet again. So for more on the build-up to the lecture and, of course, what we can expect, we go now to Konse in the Eastern Cape, where Nkosinathi Biko is standing by, and he, of course, is the son of Steve Biko and the founder of the Biko Foundation. Nkosinathi, good morning. Good to speak to you once again. Welcome to Morning Live.
Good morning, Sakina, and good morning to the viewers. Thank you for inviting me.
So, of course, a busy time, but also, in a sense, an exciting time to once again, focus on the legacy of one of the greatest sons of the soil, Bantu, Stephen Biko. So, talk to us about this year's preparations, and once again, we're still in the grips of a pandemic.
Indeed. So, for the past 20 months, we have witnessed the dire consequences of the pandemic. Like all pandemics, the predictions initially were that we would be stuck in it for around 3 or so months. It's now 20 months, and we have a global count of around 5 million people that have lost their lives. And it seemed to us that as we remember Steve Biko this year, who was very keen on the issue of public health, you will recall that the Black Consciousness Movement rolled out a series of clinics, including here a clinic called Zanempilo, as a way to demonstrate how to go about providing basic health services. So the occasion of the 44th anniversary, combined with where we are as the world, offered us the opportunity to reflect on the COVID-19 pandemic, and the subtitle to the lecture is Equity, Justice and Self-Reliance. And so we invited Dr Moeti, who of course is the director responsible for Africa at the World Health Organization, to lead us through that conversation.
And of course, it must be very busy, but of course, we also want to know how the preparations are going. And South Africans want to know how they can get involved. Where will we be seeing all of this? So let's talk to the preparations, Nkosinathi.
Well, two things. One of the things that South Africans have done very well over the years is to claim what we call Biko Week and to make it their own. So during this time, you will see people curate their own exhibitions of what Biko means on social media. And this is a touch that we thoroughly enjoy, and that's how it should be. Legacies do sustain because they live in people's hearts. But at the Steve Biko Foundation, we annually hold commemorative events around this period. Because, of course, of the regulations, we are limited in terms of numbers, but we will be gathering again this weekend. We will have, as is the norm, a service here where we are at his grave, and then we will have a gathering at the center with some viewing. It's usually open day at the museum. And all of that then will work towards a public viewing of the lecture, of course, in compliance with the protocols. And that will happen at 6 o'clock in the evening on Sunday. We will be streaming that and broadcasting that, as you know, on SABC, so that our distant stakeholders are able to participate as is usual.
And of course, yesterday I spoke to Bishop Mpumulwana about black consciousness, about your father, the man he knew, and the teachings, of course, and how they're meant to be implemented in contemporary times. So let's talk to the work of the foundation, because Bishop touched on it. But if you can maybe just elaborate on, what it is that you do throughout the year in terms of raising the awareness and the consciousness.
Well, I was delighted to see that interview. Bishop Mpumulwana, in fact, is the person that actually broke the news of the death of Steve Biko to me. As I rode with him in his car, we were going to the station to pick up my mother, and I always remember that when this moment comes. So the foundation itself came about in the year 1998, and in the preceding year, with the participation of the president at the time, Nelson Mandela, we unveiled a statue here in the Eastern Cape, a project that was led by a collection of political organizations and institutions of civil society. And that gathering reminded us that even 20 years at the time after Biko's death, there seemed to be a lot of interest in his legacy. And we then began to look at how other people around the world had gone around this notion of preserving legacies. And for us, Steve Biko has become the backdrop, but the issue is to focus on some of the contemporary challenges that face our communities. So our work is focused mainly on creating capacity at the level of youth, so that they become active agents in the various spaces. So we work in sport, arts and culture, economic justice, and then of course we run the Steve Biko Center, which is appended to support the school curriculum. We have a visitorship of around 110,000 people in a normal year, and we were very emphatic that our target would be schools, because we want to ensure that our youth are embedded in their history and in the history of the Black Consciousness Movement and Steve Biko.
Nkosinathi, thank you so much for speaking to us this morning, and of course looking forward to that lecture on Sunday. And that of course was Nkosinathi Biko, the son of Steve Biko and the founder of the Biko Foundation, talking to us about the preparations for Sunday's annual lecture. And this year will be delivered by Dr Matshidiso Moeti, who is of course the first female to head up the World Health Organization, and we look forward to hearing what she will have to say. And as Nkosinathi says, something that his father was very keenly interested in, the medical side of things, and making sure that people in communities had access to medical care and quality medical care at that. So something that will feature prominently